Yeah, it doesn't really affect patient selection very much, but I get them in to see ophthalmology just as a baseline, right? So they can establish care with them. As you mentioned, the ocular toxicity is in a significant portion of patients, right? So I'd like them to establish care with somebody, to have a baseline exam, and follow up as needed if I'm worried about some of these unique side effects. And, you mentioned, okay, it's like a different conversation with our patients about the side effect profile of Dato versus some of our other ADCs or targeted therapies. I think about it kind of like, oh, your side effects are up here.
Yeah.
Right. So, I mean, stomatitis, mucositis, the keratitis, the ocular issues, right? So those are the big things that we worry about for these patients, let alone the ILD, which, as you mentioned, is a little bit less of a risk compared to other ADCs, but still something to keep an eye on. I wonder, how do you deal with some of these side effects in terms of mucositis and stomatitis? Because that hasn't been so much of an issue in the lung cancer space for a long time now.
Yeah, we fortunately or unfortunately, we've had this story in breast cancer before. So I mentioned everolimus before as a drug that can cause pulmonary toxicity, but it's actually most notorious for its stomatitis risk. And when it fell out of favor, before we had as many active agents in metastatic breast cancer, we were really trying to get all of the efficacy out of it that we possibly could. And that forced us as a field to look at toxicity in a dedicated way, so patients weren't giving up on the drug quickly. And one of the things that we learned about everolimus back then was the prevention of stomatitis was really meaningfully impacted by use of a steroid mouth rinse. In a very consistent way for patients, which does add to some quality of life concerns, right? But I think when you're allowing patients to be more proactive, you're saying, hey, we have a strategy to mitigate this, just like we were talking about with the antiemetics, it is more successful because it's not like you're saying, okay, this drug is going to help your cancer, but we're just going to have to deal with bad mouth sores. So I have use that in my education for patients and my planning when Dato comes into the conversation. And we actually have our chemotherapy ordering plans in the electronic medical record where we have the steroid mouth rinse and eye drops built in. So that when a provider is ordering the ADC for a patient, those supportive care measures are immediately going to a patient's pharmacy.
That's amazing.
Yeah, and it's really helped because I think, there's so much to talk about in these conversations, right? Usually in the clinic visit with these patients, we're talking about a bad scan, we're dealing with the emotional impact of that, and then we're bringing up new drugs, potentially multiple options, and then going through side effects. So there's a lot to think about, and it's easy for these supportive care strategies to sort of slip through. And so we found that the systematic ordering of those supportive care measures has actually really helped getting patients comfortable with the drug, having them agree to take the medication or give it a try. That's been a best practice for us. And I agree, the ocular toxicities, I think, have worried us because it's a little bit outside of our own control as oncologists. At least with the stomatitis, I feel like ultimately I end up managing that. And I know what I would do. With the ocular toxicities, I feel like I can't get patients to the meaningful resolution of toxicity all the time. But we have found that having connected care with the ophthalmologist and optometrists, actually. I think there are many patients who may already have an optometrist that they trust or have an existing relationship. And certainly with Dato, you can leverage that rather than having to have a patient see an ophthalmologist and having that sort of delay getting the care started. So it's been, I would say, again, these are toxicities that worried us as we started implementing the medication use. But actually, in practicality, it hasn't been that bad.